Okay, hey guys, so today's muscle topic which you're gonna say is sub-occipital muscles and levator scapulae. These are two muscles.
I will be volunteer.
So, as we see last class, we talk about trapezius muscle, which is contributing in neck pain, shoulder pain, and then your migraine problems. So it's not only the trapezius which is causing the problem. There are other two muscles. The one is levator scapulae, as everyone knows about that. The next is the sub-occipital muscles. It's not a single muscle; it's a group of muscles. There are 4 muscles in it. So I'll show you the picture. You can't see it to your eye and all. So these are the next 2 muscles or group of muscles which are responsible for your neck pain or your shoulder pain or your migraine headache or whatever you call it. So we actually assume it as only trapezius is causing the problem. Okay, these are the muscles which are also causing. Main culprit is levator scapulae. So you can see the shoulder difference in people. Like one is higher, one is lower. It's mainly caused because of levator scapulae. If it's tighter, you can see that difference in the shoulder elevation. So it's not only trapezius. Its main culprit is levator scapulae. The second culprit only is upper trapezius and middle trapezius, which is causing it. Okay. So I need one person to show the. Next class.
Should I sit or sit?
I will sit facing the wall. So this is the occiput region. Okay, this is the occiput region. The muscles over this area is all called sub-occipital muscles. Sub-occipital. It's below the occiput region. Okay. So the client will be in lying down position, face down lying position. This is the area where you should do the movement. Like you have to scoop, like how you are scooping ice cream or anything. You have to scoop like that. The muscle will be released by doing that. Okay, I'm doing it in a sitting position. Okay, so this is how you should scoop. Keep it inside. It should be mild. The pressure should be very, very mild. It's a most sensitive area. It will affect because spinal cord is starting over there. It will affect your nerves also. Should be very, very careful while doing it. Should try to scoop it. When it comes to face down lying position, mat. See, home back.
I'm so happy being there.
I know, I'm so happy. My neck is hurting so badly today.
So you should sit stand or sit
on this?
No. On the head side, okay. So this is the occiput region. Now you try to scoop it like deep inside. With the finger pad. It's all with the finger pad.
Finger pad.
Finger pad. So try to scoop it. If the client has a very heavy pain, they'll feel relaxation, they'll feel the soothing sensation.
I'm feeling relaxing.
Oh,
Yeah. Exactly.
Now you know when he said sub-occipital, why I volunteered.
So this is how you should scoop it. I think the Sharon can feel that. Scooping around. Then go towards your lateral side a bit. Don't go fully lateral until the occiput region. This is how you should scoop it. This is for your sub-occipital muscles. Then it will get relaxed. Then next comes to your levator scapulae. Levator scapulae is under beneath the trapezius muscle, right? Upper trapezius muscle. But you can easily release it because upper trapezius muscle is like a thin fascia. It doesn't look like a full muscle, it's a thin fascia. So you can easily identify it as a levator scapulae. You can ask them to do the shoulder shrugging. With that you can able to palpate, or if you're most familiar with the muscle, you can easily do it. So the orientation of the muscle, where it starts the transverse process of C1 to C4 vertebra. So the transverse process over this region, C1 to C4 vertebra, it goes all the way down line. This is the muscle which actually I palpated. and then insert it into a superior angle of the scapula on this region. Exactly. This is the region which I palpated. Exactly this region. This muscle you can't palpate posteriorly. If you want to palpate, you should palpate anterior, because that's where it's more prominent. But the muscle can be visible at the posterior side. So that's it. I mean, we can see it with the finger at the posterior side. But the superior angle of the scapula is palpated only from the anterior side, like on this region.
Oh.
Exactly with this region. Okay, here you can palpate superior angle of the scapula if you do this movement. I mean, external rotation, back side. For this, as we know, the orientation is longitudinal, I mean, towards this direction. So, side to side movement, diagonal, perpendicular. Should everything?
This is very good.
For this, you can use this thumb pad release. There are 3 trigger points for it. This is the last on this area.
Oh, she has 3 today.
Usually 3 but muscle buckle 3 இடம் இருக்கும்ல. So most common trigger point region. But she has full tightness of lip. Everyone has. It's the most common tightness part.
Bro, next week.
பல வருஷமா இருக்கேன்.
On this side, this is where it starts. You can see the bulk of the muscle just moving. The upper trapezius on this side, which will go all the way behind it. On the sides, from the transverse posture, it's levator scapulae.
Whenever hand is off, I don't know what is he trying to teach.
Tension.
Yeah, it's good.
He wants to try.
இந்த பென்சில வச்சதுன்னா பாருங்க நமக்கு மேல போடுங்க நான் என்ன பண்ணேன் அப்படி வரணும் லாக்லாம் போடு ஓகே
So now rotate your head and see how is it free.
It's that good.
So you can say everyone has a levator scapulae class. If you turn your head towards one side, you can feel something is pulling on the other side. That's your levator scapulae actually.
போய்ட்டானா
No, I'm coming.
So that is the one which causes the tightness. So you can, if you want to do some test, so you know how tightness it is, right? So after the release, you can tell them whether it's released or not
Yeah,
by doing the rotation.
So learn the technique. We need to practice it.
அந்த லைன் சேம் கம்மியா இருக்கு
I have nails though.
சேம் பிரஷர்
I have
Same
nails.
pressure.
We'll have nails. I can't scoop with my nails. So this is the occipital. You scoop inside.
It is just feeling good.
No pain.
No pain. For me,
Yeah, here you need the. You want a foam pad?
Okay.
Get him a foam pad.